So yeah, good morning, everyone. My name is Paulo Marinho. I'm the head of scientific strategy here in T&R Biofab. As Peter mentioned, the title is Phenotypically Relevant Generation of Liver Models through Bioprinting. I'm not going to make this a corporate presentation, don't worry, but just for the sake of a few words of T&R Biofab, we are a tissue engineering and regenerative medicine company here in South Korea. A little bit under the radar as a company, but actually we are very active in terms of research. And as you can imagine, most of tissue engineering companies, would be like the slide that would be the holy grail of tissue engineering companies, right? We really hope that someday we're going to be able to print organs or make organs regardless of printing. And in T&R Biofab, mostly we are using three technologies that we call our journey for the better model, for a better product. And one of them, of course, is bioprinting, as you can guess. So basically, we would use like a printer, like extrusion-based, like a cell dispensers and all these kind of technologies that most of you are probably use. I think the technology, we are not using a technology similar to Alex use. I saw a few of his speeches before in the past, but it is kind of technology that we are using. Also, we have a lot of things in terms of biomaterials. Our first papers in Nature Communications were with regards of biomaterials in 2014. And basically, I mean, you have three small examples of completely different biomaterials that looks like the same. One is for liver, one is for bone, one is for skin, but actually they behave completely different. And the other technology that we are using, stem cells, mostly like iPS technology, that's kind of human embryonic stem cell-like technology. And here in the slide, I hope that you can see my video. You're gonna see like a sphere beating at exactly 60 beats per minute. That's exactly what your heart would beat at rest. So basically, this is our core technology. It's not exactly just bioprinting. We are using bioprinting as one of the technologies, but always together with the two others. And when we combine these three things, actually, we can do quite some amazing things. So just to mention three of them, one is biodegradable hard scaffolds. Here on the example on your bottom, I'm gonna try to enable my laser pointer. I hope you can see my laser pointer. So on your bottom, on your left, you're gonna see a CT scan of a patient before and after having the implants of our bioprinted scaffolds made of PCL. This patient is actually a very beautiful story because it has an autoimmune disease that the own patient body attacks its bone. And with the use of bioprinted, specifically scaffolds, we are able to induce the production of the bone of own patients. The other thing I'm gonna be focused mostly on my speech today is about soft scaffold tissue. The example that you have on the picture in the middle is about liver, and most of our research is published on biofabrication, small and advanced materials on the last 3 years. And of course, in terms of cell therapy, we have a lot of work mainly with regards to heart. So I hope that you can see the video as well, just like a PCL frame printing. And on the top of this PCL frame printing, we're gonna put some cardio-derived cells. And also we can put some mesenchymal cells for paracrine effect. Here you have in blue and red, just for the sake of the color, so you guys can see it better. But this research is also published on Nature Communications. So as I mentioned today, here's the liver work that I'm gonna be talking. And one of the things that I would like to stress is that when we talk about bioprinting, very often you see videos like that, right? And there is some companies that are expert on advertising bioprinting. And actually, I mean, it's quite cool, it's quite beautiful. You have like something that's gonna be extruded from a robot, and then in the end, you're gonna have some organ-shaped structure. Today my talk is about liver, so we made just for the talk a liver-shaped structure. And it looks very appealing when you don't know bioprinting. But in reality, we have to be a little bit more fair as researchers. There is a lot of limitations with this kind of approach. Usually we are talking about bioinks. They have to have some shear thinning properties, especially when you're talking about extrusion. We can have some 3D macro precision. I mean, it looks like a liver, right? But in the very end, what is going to define the resolution is the biomaterial that you use. There is gelation effects. So if the gelation is not immediate, maybe your tissue is going to just crumble, collapse. The precision is not the precision of the robotics. I saw many companies trying to sell printers saying, oh, we have 1 micrometer precision. Yes, you have 1 micrometer precision, but if you're using a nozzle that's 200 micrometers, that's usually the nozzle that you're using for extrusion. Actually, your precision, your fidelity is going to be like 200 micrometers, not going to be 5 or 10. Even when you use sacrificial inks, as you can see very oftenly from the Vase Institute, United States, still you're a little bit limited to more to macro structures, not the micro vascularization that you have. So there's plenty of limitations, and of course the shear stress that induces some cell death. There's plenty of limitations that I'm going to try to address today on the talk. And so basically what you have the macrostructure that you can reproduce very well. You have somehow the between structure that's kind of okay, but if you look at the microstructure to acknowledge the tissue complexity, we don't have that when you have the extrusion, because once again, we are talking about precisions of 200 micrometers, and sometimes we need precision, for example, on the central vein between 80 and 150 micrometers, the sinusoids of the liver that tends to be between 20 and 50 micrometers, and all the other structure that you see in the vein, right? So here in T&R, we were thinking, how can we approach this specifically situation to make a solution that's quite helpful for the community. So this brings to our first publication on the biofabrication, which we use a very interesting approach that's called molding. Molding is extremely precise technique that you can have up to nanometers precision. So instead of using a classic head to extrude our ink, our bio ink, we extrude the bio ink through a mold that was put inside the head of the printer. So it looks complicated, but actually it's quite simple idea. So you have the mold inside of the head, you extrude, and you expect the shape to be more or less the same. So that's what we did. And just the proof of concept without the cells. Here we are printing like a four-shaped pattern to see how it's able to keep its shape after the printing. So you have the head that's around 1 centimeter, and then you have different size of nozzles that you can appreciate on the picture, from like almost 1 millimeter to 200 micrometers. And of course, as it gets lower, the size of the nozzle, you're gonna have more pressure when the bio ink's being extruded. And then, of course, it's going to swallow a little bit, right? When it comes back, as you can see, like the nozzle from 840 micrometers keeps 840 micrometers. The nozzle from 200 micrometers keeps a little bit bigger. That's normal. However, every quarter that was printed, that we tried to put this shape, it keeps like a very similar approach. You can, a very similar size. You can see by the standard deviation that's very low. And the degree of miniaturization, regardless of the nozzle that we're using, actually it's very interesting, because we can reduce to 20 to 30% the size of whatever is inside the printing head. With that, it brings the question, so what's the impact of this on the cells, right? When you use this kind of approach. So the impact on the cells would be most related to shear stress. So as I mentioned in the beginning, one of the things that the companies don't mention very often, that as you decrease the nozzle to get more resolution, you start to have more shear stress. And sometimes you don't see the effect right away on the cells. If you do a live and dead assay, you see the effect like 2 hours after, 24 hours after. So you can appreciate on this graphic, right, that as it gets smaller, the nozzle, you have a much lower viability. So the question that we're going to ask is, does it work when you use the preset printing? And the interesting fact is that if you remember your classes about mechanic fluids, like the laminar flow, right, you have much more difference of the speed when it's getting close to the wall that the cells or the bio ink is being extruded, right? So you have this difference of speed that's going to generate the shear. And in the case when you're using a 200 micrometer nozzles, you're going to have this shear stress 4 times on whatever you are extruding from the printer. However, when you're using the preset printing from a 840 micrometer nozzle, you're just going to have this shear stress a little bit once. So actually what we managed to do is increase the cell viability. So because we barely have any shear stress in the beginning, you just have the shear stress when it's being extruded. So the other point that we try to understand is about design. So if we can do like 4/4 of a circle, can we do more complex designs? And yes, we can. So here you have the example of the spinal cord, the hepatic lobule, capillaries, and blood vessels. We have many other patterns that you can check on the biofabrication article, but it is just 4 of them that I would like to highlight. And specifically for the liver, if we do the printing where you use this pattern to put the endothelial cells on the hexagon shape and the hepatic cells between the hexagon shape, you're going to have like this beautiful pattern that resembles a lot the liver, right? Much more than the pattern that you have when you just mix some cells. I know that in the beginning of the bioprinting, there were some professors saying, oh, the biology will do its own job, but actually it's not exactly like that. It's even very interesting to notice in the beginning for the first 3 days that when you just mix the cells and extrude the cells are still very round. The exoskeleton of the cells is not exactly really well attached to the matrix. And when you use the preset printing, they adapt much faster. So meaning that you are helping biology to do their job. And most interesting, I would say, that when you keep the shape, actually you have improvement of the dynamics of the liver. And when I say dynamics is, you're probably going to use that for some drug screening test, right? And the classic test is like using like rifampicin to induce the expression of the enzyme CYPA3A4. You can see here on your right side by the luminescence assay that you have an increase of around 40 to 50% if you compare just the non-structure with the structure. And we did this until day 5 because, as you can imagine, the tissue is still very thick. So we don't have as much nutrients diffusing to the center, and then the tissue starts to die. So that's a problem that we have. So that brings us to the new paper that we got the cover on small 2 years ago, that how to produce the lumen, right? So you can decrease the problem of nutrients diffusion. So we use exactly the same strategy, the pattern printing, but we added a little pattern in the center that I hope you can appreciate, where we're going to use a sacrificial layer to be able to then have a hole inside of our tissue. So for the people that are mechanical engineers, I'm not a mechanical engineer myself, but I think the graphics will talk right away. We did a bunch of combinations of collagen, that is the bio ink that we are using for the cells, and alginate that we are using for as a sacrificial layer. And then we found a combination of these two compounds where we could extrude both of them at the same time without losing the pattern, as you can see on the figure B on your top. And here you have an example with the endothelial cells. You can see that the lumen is very preserved for the course of the days. So we are not talking about day 4 and day 5 anymore. We are extending to the day 7. So this is very interesting. The cell viability, as with the biofabrication paper, still it's very high. And the cell confluence keep getting higher through the days, meaning that the cells are healthy and they are growing around the tissue. So pretty much everywhere, like on the surface, inside, but the lumen keeps its shape, it keeps open. One of the things that were very interesting as the biofabrication paper, we compared this approach with just mix, extruding the cells, with the mix of cells and the lumen, and the preset printing, as I already explained here, with the lumen. And the thing that was most interesting, once again, that is not just about the biology doing its job by its own, because if you keep the tissues extruded with a lumen for a long time, the lumen, actually the channels collapse, so they are not able to keep. However, if you pre-position the cells while you extrude using the preset printing, actually you are able to keep these channels open. So here we just quantify that, how, I would say, how circle it is this lumen, like the circularity of the lumen. And if you compare the preset with the mix, where the two have the lumen to start with, you can see a huge difference, right? Like around maybe almost double of circularity was maintained. Another thing that's very interesting, if you compare this first approach that would be similar to the biofabrication paper that I just presented, the cell viability is also maintained. So as I told you, starting on day 5, the cell viability starts to go very low when you don't have the lumen. Now that you have the lumen, the cell viability keeps very high. So this is very interesting because we are able to overcome one of the issues, which is the cell nutrition. And another point that was very interesting, that if we start to pile up these tissues, what happened? Can we keep these tissues alive for long? Well, we cannot keep these tissues alive for very long. I would say that we can keep it for 7 days or so. But one thing that we didn't predict, actually, this was one of the reviewers from the paper that asked us, to be totally honest, said, what about the mechanical properties of the tissue? What happened with them? So we noticed that just from the day 1 to the day 5, we had a huge increase. So here in green, day 1, in red, day 5, a huge increase in the mechanical properties that is almost similar to the real liver. So it's very interesting because the cells are really healthy and reorganizing and trying to behave like real tissue. And I think the last graphic that proves that is exactly, once again, the dynamics, right? So here we are at day 7. You can see the mixed cells with the lumen, right? You see no structure whatsoever. And here the preset printing with the lumen. You can see that the structure is maintained for quite long. So CD31 just for endothelial cells, albumin for the liver cells, hepatic cells. And if you look the graphic E, right, when you have the SIPA activity, you can see that if you compare to the mix, always you have at least 40 to 50% of increases of enzymatic activity. Again, you also have the increase of other things. You can go into the paper for the details. I'm not going to talk much about that, but albumin, urea, MRP2, the CD31 expression that represents the health of endothelial cells. We can go more into details. You can shoot me a message. I'm going to be able to explain more in details to you if you're curious about it. And lastly, let me remove the laser point. That's what we have, the pre-cover of advanced materials last year. It's, can we make like liver buds? So we did a little modification of our preset pattern, that we have the printer of our, the head of the printer of our bioprinter, right? And then outside, we put a laminar flow of mineral oil. So basically, I think you can see my pointer right now. So you're gonna have the head of the printer here, where your fibers, your bio-ink is gonna be extruded in parallel with some mineral oil that's gonna be flowing at the same time. So if it's a little bit hard to see, I hope that you can see my video. I hope that the video is working. Yeah, I think the video is working. So I hope that you can see that there is like micro spheres being dropped, right, on the arrow in red. So basically, because it's very simple, right? Oil is not going to mix with water. So you're going to have spheres being formed, and not just spheres being formed, spheres being formed with the pattern of a liver. So you're going to have liver buds. I hope that you can appreciate the difference between the top graphic and the middle graphic. This, I think, is day 5, if I'm not wrong, or day 7. And another thing that's very interesting also, that you can keep a very good control of the size of the spheres when you are extruding them through the mineral oil coaxial printing. So another thing that's interesting, once you extrude them, you can expect that they're going to contract a little bit because the cells are rearranging the extracellular matrix. If you compare to the first paper of the biofabrication, the one without lumen, of course, because the spheres have no lumen, you're gonna see that there is a much better diffusion of nutrients, meaning that you're gonna have a lower hypoxic condition. So here, comparing day 1 and day 4, again, we went until day 4 because on the first paper on the biofabrication, we didn't have the lumen, so the tissue starts to die, and we can barely see any hypoxia on the spheres. So this also, there is a reflex on the viability. As I mentioned, after day 4, day 5, they started to die. You can see day 7, day 10. All the red dots, they are tunnel positive cells, meaning that they are dying. And the spheres, you barely have any. So this is very interesting in terms of viability. And you can start thinking about things like HTS approach, like high throughput screening approach, right? So this is how the cells look like after 10 days. You can see that they have a very beautiful liver pattern shape. If you just print the cell as they are, I think I still have 2 minutes, yeah. If you just print the cells as they are, you can see that there is no structure whatsoever. And once again, you're going to have a very strong reflection on the enzyme expression and also all the proteins like the albumin formation, the urea degradation, the antitrypsin secretion, all the kind of compounds that are related to liver, they are actually improved just by the use of this structure. And again, same amount of cells, same procedure, same printer, same pressure, everything's exactly the same. The only thing that changed is the structure versus non-structure. Because we were very motivated with this approach, we decided to do some injections on mouse to see how the spheres would incorporate on the mice. And one thing that you could appreciate on the graphic here, on the top you have structure, on the bottom non-structure. I don't know if you're very used to see HES, but every time they have like this pinkish color, it means like some sort of fibrosis. So probably the tissue is dying. Also, you can see in the structure pattern that you have alpha SMA and CD31. CD31 more related to endothelial cells, alpha SMA more related to hepatic cells. So this is very positive things that you do not see on the non-structured ones. And as we predict, because of the pinkish color of the HES, there is a lot of tunnel expression, meaning that the cells are probably dying. So future work and what we are actually doing, we are doing like big pieces of tissue, like 1.5 centimeter by 1 centimeter, and trying to keep them alive through perfusion and other techniques, something that I'm not ready to it's not mature enough to share with you. Also, we are trying to develop the next generation platform for high throughput screening because the spheres are behaving very well. They have a very good enzymatic profile. And with that, yeah, I would like to thank you, Peter and the organizers for inviting me. I don't know what the time it is because but I hope that it was interesting, and I would take any questions if you'd like so.